Hi, good morning. Today I'm going to talk about 5 things you should know about revision or second rhinoplasty. I hope this video will better inform you to make a decision about your upcoming revision. Let's get started. First question, who needs revision rhinoplasty? Some patients happen to figure out that whoever doesn't like their nose would be a good candidate for revision rhinoplasty, but that's totally wrong. There are certain limitations regarding the type of your skin, bone, or cartilage, and there is no magic to change the genes you've inherited. For instance, if you have way thicker skin, it mightn't get delicate as much as you prefer, because the problem is in the skin, not beneath the skin, and it wouldn't end up in happiness. So the surgeon must disincline to acquiesce to this kind of request. So in order to do revision rhinoplasty, the nose must have obvious flaws or imperfection. Otherwise, it wouldn't make the patient happy.
I trust Dr. Amir.
So I prefer more of the natural look for my nose, and I found that Dr. Sajadian is able to achieve that kind of look that I'm looking for.
Second thing, minimal revision versus advanced revision. Sometimes patients just need minimal revision surgery. It means, for instance, if they have thicker skin, they might complain about accumulation of fibrosis and scar tissue, or if they have thinner skin, they might complain about a little irregularity after a while. There are 2 examples of minimal revision surgery. In that situation, the result is near to perfect, and the duration of the surgery is short, and the risk is low. But opposing to that group, sometimes the problem is bigger and needs more attention. So let's talk about advanced group.
Dr. Sajadian is definitely the best from what I've seen online, so I'm very, very excited.
I read a lot of comments about you, and most of them was positive. And it gave me a good feeling.
Advanced revision includes 2 groups, under resection cases versus over resection cases. In under resection cases, less bone or cartilage has been removed than might be needed. These patients might complain about remnant of the hump or enlargement of the tip. The surgery is way easier than the following group. In over resection cases, the problem is more complicated, and sometimes the patient needs some graft for bone, cartilage, or skin to compensate those wasted tissue. The source of this graft would be from the ear, septum, or the rib.
I came from the United States in California to get my nose done with Dr. Sajadian. I've seen his work on social media, and I really liked his work, and that's why I'm here, because I trust him.
Best time for revision rhinoplasty. All surgeons agree that at least 12 months should pass from previous surgery to allow for complete softening of scar tissue and fibrosis. In thicker skin patients might be necessitated to wait even for 2 years to get ready for revision rhinoplasty.
I found a few doctors, but I specifically chose you because your profession is just noses and ENT, and that's what I want.
Thank you. Would the result be perfect after revision rhinoplasty? It highly relates to which group you are in. If it's minimal revision group, then the result is always near to perfect and the patient would be happy. But the advanced group results are versatile. In under-resection cases, the result would be better than over-resection cases, which might need some graft. It means if you belong to the last group, it would be better off to adjust your expectations to the level that your surgeon might explain to you. And eventually, revision rhinoplasty is way more difficult than primary rhinoplasty, which is already its difficult procedure. Thank you.
Okay, I am a patient from London. I've come to see Dr. Amir to get my nose done.
Okay, so I'm coming from Canada to do my nose with Dr. Amir Sajadian, and I just want to remove the bump, elevate the tip, and make it more refined, and a little bit shorter from the front profile.